All right. Well, thanks everyone for sticking around. Is my mic working okay?
Yep, we can hear you.
Okay, perfect. So I'm just so impressed. I know it's a late night for a lot of you. I was excited when I found out it was on Eastern time since it was a little bit earlier for me. Usually it's past my bedtime. But so I'm Larissa Pavone. I'm the program director at Marianjoy. I'm going into my second year as program director, but I've been at Marianjoy for I think about 8 years now. I'm a pediatric rehabilitation doctor, and that's my primary practice, but obviously help out with the adults on weekends and calls as well. And then of course, do a lot of adult rehab with our resident physicians. So I don't want to take too much time up because I think it's more important that you guys hear from the residents. So we have a handful of residents from the program, one from each year, well, and then our chiefs as well. So I will hand it off to Lirdon, who is one of our PGY2s.
Thank you, Dr. Pavone. Hello, everyone. My name is Lirdon Zendelli. I'm one of the PGY2s. Just want to give you a brief overview of what the second year is like. During this time, we spend rotating through the different inpatient units at Marianjoy, including stroke, brain injury, spinal cord injury, MSK, general rehab, and at the VA. These are 2-month-long rotations where we are paired up with one attending as the only resident on each service. We admit up to 14 patients per service, mostly from the Chicagoland area, but also from different parts of the Midwest. So we get to see a wide variety of pathology here. Our time commitment is typically 7:30 a.m. to 4:30 p.m. Monday through Friday. We do take a 24-hour call 4 times per month, but we get post-call day off, so it breaks up the week pretty nicely. We are a freestanding hospital, which means that we are the primary service for these patients and respond to things such as rapid responses, codes, and we have a slew of medical subspecialists available to us for consults as needed. Thursday mornings, we have protected time for didactics where we go over book chapters, journal clubs, and grand rounds. Overall, the inpatient service is a very supportive environment with a strong teamwork ethic across all medical, nursing, and therapy teams. Now I'll hand it off to Aman to talk about the PGY3 life.
Can you guys hear me?
Yes.
Okay, cool. Yeah, so I'm Amanpreet Sani. I'm one of the PGY3 residents at Marianjoy. So your PGY3 year starts off with anatomy course. So you're taking it at Midwestern. So 2 days a week, you're just focused on anatomy. You're excused from your work duties. And it kind of builds the foundation for the rest of your PGY3 year, which is pretty hands-on. So I started my EMG rotation, and learning anatomy at the same time kind of put everything together. You work with 3 attendings, so there's no fellows, there are no other residents that you work with, just 3 attendings. So you get to see like 3 different styles, 3 different techniques. You get a lot of opportunity to learn, and along with, and now I'm on my pain rotation, and it's a similar thing where we have 4 attendings. There's no fellows or other residents. My second day, I was assisting on procedures. You get hands-on experience that some residents don't really get until pain fellowship. So if you're interested in pain or going into that fellowship, you get a lot of hands-on experience at the Hines VA where we do our pain rotation. You also do some inpatient as well. So you'll do your pediatric rotation at Marianjoy. That's for 2 months. It's a balance of inpatient, and you'll also have some outpatient as well. So you'll see some follow-up, and then you'll have some opportunity to do Botox. PGY3 year, you also have a 2-month PM&R outpatient rotation as well. You get a lot of autonomy. So you'll be doing some procedures, injections, trigger points, some Botox injections. You'll be able to see SCI follow-ups, TBI follow-ups. So you kind of get to see a little bit of everything. We have another Msk and Pain Rotation at Loyola University, Loyola Hospital. So you'll work with Dr. Bajaj, who's awesome. You'll do like pain procedures, you'll do injections. He does EMGs as well. it's a nice opportunity to see kind of all those things that you learn in PM&R in practice. He does basically everything. And then our last rotation we have at Rush Copley. So we work with Dr. Keen, who's the director there. You manage an inpatient unit, and then you also have opportunity to do hospital consults as well. So you get that balance. And Dr. Keen is awesome. He teaches you not only the medicine side of things, but the business side of things as well. So he'll teach you like things that you need to put in your H&P, how to bill for stuff. And he's kind of done every sort of thing in PM&R. So he's a really good resource to have. And that's basically it. Your PGY 3 years is pretty awesome here at Marianjoy. You kind of get to see a little bit of everything, and everything kind of comes together. And yeah, that's basically it. And then we have Neha Kohli. She's our chief resident and PGY 4. So she'll talk a little bit about that year.
All right, like Aman said, I'm Neha. I'm one of the PGY 4s. So just to talk a little bit about fourth year, it's all outpatient. So we spend about 4 months doing mostly just outpatient clinic on the main campus at Marianjoy. So it's right across from the inpatient hospital. So you do a lot of Botox, joint injections, EMGs, everything you would expect. You also have the opportunity to do a lot of follow-ups from inpatients. Like right now I'm a fourth year and I see patients that I might have seen as spinal cord patients and the inpatient side as 2 when I was a 2. So it's nice to have that continuity of care. We also have a strictly EMG rotation, which I'm on right now. So for 2 months, you're just doing EMG. So Monday through Friday, that's all we're focused on. So it's not hard to get in all your numbers. We go to multiple sites. So you work with different attendings. You get used to different ways of working, different machines, and just get familiar with everything. We do have the opportunity to do a 2-month elective as well. So as Dr. Sony was saying, you know, we can work with Dr. Bajaj. We now have the opportunity to do some subacute rehab work as well as an elective, because prior to this, we didn't really have much exposure in that department. You can choose to use it as a research month. Basically your choice. You can do whatever you want with your elective. We also work at a couple different VAs. So we work at one that's a little bit north of us and one that's a little bit west of us. And so again, you get outpatient experience at both of those locations. Some of the great things about fourth year is there's no call, you don't work on weekends, and you have a lot of time to study for boards, which is obviously very important. Those are the basics of fourth year. And now we will have Dr. Garish Sony taking over.
All right, guys. Hey, can you guys hear me? Speaking from my phone, so sorry about that. So thanks for Neha, Liridon, and Aman talking about all the years at Marianjoy, kind of how that looks like, how it breaks down, what to expect from you guys. So we actually talked to a couple of med students who have been following these PM&R scholars and took some feedback on what you guys want to hear. So we came up with, why Marianjoy? Everyone has their, selling point on why to apply there and things like that. So these are some of the things that I took into, because I rotated here as a med student as well. And so I wanted to know some of these things during the application process, but I didn't because I didn't ask. But that's why we're here. So some of the big things are most of the rotations that you do at Marianjoy are within 20 to 30 minutes, if not at Marianjoy. Those are going to be mostly during your 3rd and 4th year. Some of the rotations are maybe like 35 or 40 minutes away, but those you actually get compensated for per mile that you go over with your commute from Marianjoy to home versus home to, say, North Chicago, where we do one of our level rotations during 4th year. So it's definitely a good incentive to say, hey, why am I driving so much just to do EMGs? But there is that incentive that you get paid a little bit for all the miles. Our EMR was Meditech. If you guys know what that is, it's terrible. It's like playing a Sega Genesis, back in the day, which isn't bad, but now it turned into Epic just 2 years ago now. So we're fully functional inpatient, outpatient through Epic, along with all of their Northwestern affiliated hospitals. So that's really nice. As Aman mentioned, we don't have any fellows. So we're honestly like first assist on all procedures, everything. We had someone, I think, break the record for EMGs and pain procedures in 1 month. Obviously, they were interested in pain, so they were just doing everything. But they had over 130 procedures in just 4 weeks, which is really nice. Our match history is awesome. just in the last year, we matched at UC Davis for pain, University of Wisconsin-Madison for pain the year before. We've also matched at Stanford for spinal cord injury, as well as Johns Hopkins for peds. Definitely more in the past, just a couple, throw out there. Parking. Parking is a huge issue. I didn't want to stress about parking every single morning going to work. So we have on-site parking. It's easily accessible. I've never had an issue with having any available spot, and you walk probably less than, 200 feet to go to the main entrance, which is really nice. We also have our own form of moonlighting. It's something that I was definitely, interested in as a PGY3 and a 4. Once you do pass your COMLEX or USMLE Step 3, you are eligible to start moonlighting. So what is it? You basically do backup admissions for the call resident. Anytime there's more than 2 admissions for the call shift, the backup resident will be called in, and you do the admission, you put in all the orders, talk to pharmacy and families and things like that, and you get $100 reimbursed. So it's really nice. It's good incentive. It's not something that you're spending too much time doing. You're not going over your duty hours and things like that, but it is nice to have that. On Thursdays, we do have didactics. So sometimes, the concern is, well, I have didactics, but I also have to go back and write all my notes. So the attendings here have signed up to write all of our notes on Thursdays when we do have didactics, which is actually really nice because then, you could just focus on learning instead of being stressed about writing notes and things like that. The post-call day was mentioned. Not many places that have, call have that because they might have home call, whereas we have the in-house call, which is, it's really nice. If you have a call on a Tuesday, you can get all your errands done on a Wednesday. Pretty self-explanatory. Just when we go job hunting to job fairs and things like that, we actually, we talk to recruiters, we talk to companies, and the minute we mention Marianjoy, they know how good our training is and how comprehensive it is, that they're just right away, they're like, oh yeah, we know you guys are really good at Marianjoy. So it's a good, it's a good feeling to know that when you're going to look for a job or a fellowship or whatever. One of the biggest perks I would say about Marianjoy is that Northwestern covers your medical, dental, and vision insurance. It comes right out of your, it's put in your paycheck, but then they cover it completely, which is awesome. And it also includes your family. Let's see. You also have Northwestern discounts to sports games, restaurants, hotel car rentals, small perks, keep you going. Another huge thing that I don't think a lot of residency programs have, just to my knowledge, is we get an annual wellness fund. It's about $250 that you can put into any fitness-related products, say it be membership to a gym, athletic shoes, running shoes, lifting shoes, whichever, or you can have equipment. Sorry, someone have a question?
No, I said, or AirPods.
Yeah, or AirPods. Yeah, that's our huge incentive, and you get $250 every year. Another thing that discussing with other residents and colleagues of ours, we noticed that Marianjoy does a really good job of not only getting us to conferences because we have such great cases here, but also we get a lot of financial support with the cases. So, if you're a first author during your PGY 2, 3, or 4 year, you get, over $1,000 compensated for AAP or AAP&R, or both, just depends. And then another thing I would say is you get $170 during your PGY 3 and 4 year for book stipends, or say you have a Q bank or something like that. And then the last thing, which I think a lot of people have, but we have what's called an Armeo. We also have an Amadeo, which are used for arm and hand, kind of like robotics to help with patients with stroke, spinal cord injury, and things like that. We have an exoskeleton. We have a 0G walking machine. We also have these video goggles called Real Eyes X that helps with, balance, coordination, response time, and things like that. We also have a bird tag visual reality system. That's really cool because it helps you not only help with the memory, but your vision, your coordination, and things like that. But that's really it from my end. Do you guys have any questions, or if anyone else wants to, continue?
Yeah, let's open it up to some questions. So we can leave some time. I think we only have a few more minutes.
You guys have just over 5 minutes.
Oh, okay. Okay, I thought we were a little
Good.
shorter than that. All right, we're ready. Okay, so the first question, do you have any leadership opportunities or chances to learn more about medical administration as a physician? Does your program have a mentorship program? Does your program have any exposure to adaptive sports? So leadership, there's a lot of leadership opportunities. I would say all of our residents are involved in quality projects. Just tomorrow, we have like a quality of care meeting that occurs every few months, and 2 of the residents are presenting there. They pair up with different administrators throughout the hospital. And if anyone was really interested in going on an administrative track, I think it'd be pretty easy to get that set up, just because, you know, even though we are a big hospital, about 120 acute beds for rehab, it's kind of like a small community since we're independent site. So I think there's a lot of opportunities for that. Okay, I love it. There's a lot of questions coming in. For adaptive sports, you know, we have some opportunities within the community that we've done. I don't know if any of the residents have gotten involved individually in any of the adaptive sports. I know we've helped out at the marathon for sports related coverage things, but I'm not sure. I know through the park districts and Shriners Hospital, which Shriners isn't one of our sites, but you could do elective opportunities. They have opportunities for adaptive sports there. Community outreach opportunities and underserved population. Obviously, I know you're not talking about, this year is a little tough because of COVID, but we do have like a Parents of Marianjoy that we have through the pediatric program. We do the Heart Walk. I'm trying to think, you guys, other things that might come to mind when you think of that.
Yeah, I was actually the first responder for the Chicago Marathon. Obviously not this year because it's going to be canceled, but that was really nice, a good experience, like sports medicine, kind of being that first responder for those runners. Yeah.
There's other opportunities that we have in the community, but just since me being new to the program director, but we have like Ronald McDonald House by the hospital that I wanted, one of the things I wanted to is for us to go volunteer over there, but right now we just really can't do anything like that. Is the program adaptable? Can you engage into projects with other departments? Yes, I think this is just the tip of the iceberg. We've been part of Northwestern Medicine just for the last few years, but there's so many opportunities within Northwestern Medicine. It's a huge network of hospitals that cover within the city and into the greater suburbs, and there's just so many opportunities that I don't even think we've started to experience them fully. I don't know if your specific departments that you're looking for. Ask that question.
I think part of, you know, rehab that we really like is that it's a very interdisciplinary field in terms of being collaborative. You know, you really do work closely with the therapists, with the pharmacists, with the nurses. So in terms of doing projects with other departments, as Dr. Pavone was saying, we are a standalone hospital, so we have 120-ish beds, but we're very close with those people, like, as I was saying, the pharmacists, the therapists. A lot of us work on different projects, you know, like different publications with the pharmacists, with the nurses. And so we have opportunities to display that work as well.
Guys, I have about 2 minutes left.
Okay. One thing about, you know, the residency program, which I don't know if you can get a feel from it from just hearing us, is it's just definitely like a family-like atmosphere that we have within our residency program. I just love spending time with the residents. The COVID pandemic's killing me because we can't have our regular bigger get-togethers that we typically have, but I think everyone really enjoys each other's company and has a great time together. I know there's a question about any performing arts medicine. We don't have anything at Marianjoy directly, but again, within the NM system, I'm sure there's opportunities for that. Where are all the sites the residents rotate at, and how far apart are they? The residents live all over. So we got someone in the city, we have someone in a northern suburb, and Aman, you're in the city too, right?
Yeah, northern suburbs.
Northern suburbs. So we have 2 in the northern suburbs. You know, we're about 20 miles west of Chicago, and our sites, for the most part, everything's probably a 20-minute, but if there's like no traffic where we are, would you say 20 minutes is the max, except for Lovell, which is far up north from us, which is about, I don't know, I don't want to lie about the time. How long does it take you to drive up there if you were at Marianjoy?
Yeah, it's about, I think I mentioned it, it's about 40 to 50 minutes.
Yeah.
Most rotations are within 20 minutes from Marianjoy. Most people live either right next door to Marianjoy in the suburbs, or they live in Chicago just because of the lifestyle, but they both seem to manage like pretty fun, like well.
Yeah, and I have to say for the Level site, the experience that I had, one of our residents who just graduated, Dr. Disha Patel said, you know, it's kind of a far drive, but the educational experience is so worth it. Because again, like a lot of the other sites, you're the only person up there, so you get the injections, EMGs, and there's no one else there for that experience.
Awesome, guys. Thank you so much for your time.